The time is now 4:09 p.m. I call to order the meeting of the Health and Mental Health Committee. A copy of the agenda for this meeting may be found on the county website under the tab for the Legislature. Please remember to silence all cell phones and electronic devices. And at this time, I ask you to please rise for the Pledge of Allegiance. Thank you. Pledge of Allegiance
to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Doreen, will you please call the roll?
Absolutely. Emo.
Here.
Benelli. Present. Keller.
Here.
Stellar.
Here.
Ramos. Sutherland. Here. Tui.
Here.
Hotel.
Here.
7 present.
Nope.
Oh, I do.
Sorry. Step out. So first on the agenda is Lacey Trimble, Commissioner of Social Services and Mental Health. Lacey, will you please join us? So item 1A requests a supplemental appropriation of the New York State Welcome Orange Geriatric Initiative unspent 3-year 2024 funding into the Department of Mental Health's 2025 budget due to some contract agencies having unspent funds from last year, which will be used in 2025 in the amount of $13,271.22. Legislative request number 60. Can I have a motion, please? Sutherland?
Second.
Powers?
So the WOGI program, I think everyone is familiar with. This program is an OMH funded program that requires us to coordinate with multiple partners to help people be able to stay in their home. We had some of our contract agencies not spend all of their funds last year. This time a fairly small amount, but the state is allowing us to roll it over and use it for the home modification portion of the program that's provided. So independent living provides that piece of the program. They do everything from ramps to grab bars to repairing holes in people's roofs. We had one person who received a stove because their stove was leaking. Anything that we can do to help them to be able to remain in their home rather than going to a higher level of care. So these funds, if approved, will be rolled over to add to that fund that they're using currently because it gets exhausted very quickly despite the community partners that they've engaged. For example, Home Depot has gone in on half of the supplies with them on a few of the ramp projects.
Thank you. Do you have any questions? All in favor? Any opposed? Yes, motion carries. Next up, we have the monthly update for the Department of Mental Health.
So I'd like to start with an update on Catholic Charities and where we are with that situation of them having to close their treatment programs across Orange, Sullivan, and Ulster counties. To start with, I have a draft RFP in process of approval to have those services replaced. There is state aid connected to those programs, as well as some county dollar, and we don't want to lose services for the community. We're meeting with Catholic Charities and Oasis regularly to ensure that all of the individuals who are currently enrolled in their programs have a soft landing in another program if they're not ready for discharge. So Monroe and Walden, those locations did not open in 2025. They did not have enough staff to support them. So that leaves us with Port Jervis, which is going to cease all operations on 3/21. They currently have 29 clients who are in the process of completing discharge or being transferred. If there happens to be anyone who hasn't been able to make that first appointment before they close on the 21st, they will be seen in their Goshen location until that first appointment. The Newburgh location will close mid-April. Currently, they have 28 clients enrolled and being served in that location. All 28 have received a referral and are awaiting their first appointment. So we're again hoping that all of those first appointments will happen before their closure mid-April. The largest location for them is Goshen. They currently have 81 clients. Their plan is to try to close that program by the end of May. So this is all happening very, very quickly. They're working on making all of those referrals. I have to say the provider community has been wonderful about working with them, working with us, accepting all of the referrals. Our clinics will probably end up absorbing some of the clients in Port Jervis as well. I am very happy to say that with a lot of conversation and happy to see the Restart program will be making it to the end of the school year. So that was a big push for us. Restart, if you don't know, is a program that allows students to go to BOCES, receive their substance use disorder treatment, and continue their education. So I am hopeful that if I can get everything lined up very quickly, that we can have that program back as early in the school year as possible for next school year. Any questions on cafeterias? So just a couple of quick updates. The Substance Use Summit Part 2 is happening on the 27th. There are 2 sessions. The topic in the mailing, the hidden risks of legal substances and the connection of lawful acts. There's one session from 8 to 12 that's really geared more towards providers, and then a second session in the evening that's more geared to community members and first responders whose schedules may work better with that kind of a venue. We have lots of space left if anybody is interested in attending. They are very large venues. I wanted to just give a recognition to ADAC for their poster contest this year. They received over 1,600 posters and essays from 33 different schools across 10 different districts. They have selected one overall winner from Monroe Woodbury, who's a 6th grader. The theme this year is Hand in Hand, Make a Stand, Be Drug Free. Once they release the actual images of the posters and things, I will gladly share them with everyone. But that's a really great prevention effort and a really great response this year. Disaster mental health team had 2 call-outs since our last report. Interestingly enough, one of them was in response to a need in Chester, but an event that happened in Texas, where a group of cheerleaders went to a competition in Texas. There was what was thought to be a targeted violence active shooter incident. There didn't end up being one, but in the fear of all of that and the running, there were some injuries. And there were several kids who texted goodbye messages to parents and then couldn't get back in contact with their parents for hours because they were, on the country and, staff couldn't find kids. So they asked for support. We sent a team out there to help support. The other was actually a request from the state to support the individuals who were sent to the correctional institutions because of the strikes. We've sent them our names. So far, they have not taken up on our people, but they have reached out across the state to have support because it's been such a hard thing for those who are not used to working in that environment and all that has been going on there and still is a challenge now. Just a quick update on the First Responder Peer Support Program. They applied for New York CARES Up grant funding and did receive that. So along with us adding the individual that you guys approved funding for recently and was hired, they have training money in the amount of $30,000 a year for 2 years. So they'll have $60,000 each for fire, law enforcement, and dispatchers. For some reason, they did not get it for EMS, but we've put the question out there to find out if there was a reason they were not awarded for EMS. So it'll be $180,000 over 2 years to help provide that training and really build that team, which I think is great. I provided in the update copies of training flyers for psychological first aid as well. I know there was some interest expressed in individuals on this committee taking that training. That training is available to anyone in the community. There's no clinical experience needed. The second training that they're doing, Fundamentals of Disaster Mental Health, is only for active team members. And that will just give them enhanced skills when they're responding. And then satellites, Port Jervis Middle School and High School operating certificates were received. We just received those, so it probably will be, I would guess, next school year before we're fully up and running in those districts. Goshen Mental Health Administrative Building, True and Moon Elementary, and formal applications are still pending. Valley Central was approved last time, and we are working on identifying a candidate to hire for that position. And then I, as requested, included data on our clinics. They are really producing a lot of services and doing a lot of great work. I did some quick review of their data compared to last year, and they've done 11% more admissions, served 8% more people, and provided 16% more services than they did in 2023. So, and the numbers are already trending higher this year.
Thank you very much.
Any questions on the data?
Did Portuguese come in, right?
For Jervis, they were approved for middle school and high school, but just about a week ago. So we will start, posting positions and hoping, but chances are it'll be next school year before it's up and running. Since the kids won't be there.
Any other questions? Very good. Thank you very much for your document and for agreeing that you got out of this. Thank you, everyone. Thank you. Okay. Up next, we have Lauren Perdue, Commissioner of Valley View, and Donna Strecker, Director of Finances, Valley View Center. Number 2A is our monthly financials. Can I get a motion in a second to read the financials? Second.
Good afternoon, everyone. We have two financial reports we're reviewing today. We have an updated December 2024 reconciled to the general ledger as of 3/12/2025. There's been no change in the IGT funding since the last publication. We're still at the $13,473,620. Interest earnings, that's new. That wasn't on the last publication. We received the interest earnings on our cash account. That totaled $1,728,690. That was nice revenue, more than anticipated and budgeted. It came in over budget at $258,690. Other revenues coming in at $36,377,601. Personal services, $19,713,994. On the contractual side, we've pretty much expensed everything at this point. We have $13,805,985 that we have spent. The indirect cost for the county services posted, that is $2,293,506. And employee benefits coming in at $16,021,599, and a small amount of serial bond interest, that's $62,294. The 2024 audit is currently underway. The auditors were on site this week. So I'll keep you apprised of any updates. They will be here when they complete the audit to present the final audited financial statements for 2024. So as we move into February, we also have an audit going on right now it's an audit from CMS of the facility's payroll-based journaling data. That's the data that we're required to submit to determine our minimum levels of staffing requirements if we're meeting compliance. So it was our first time we had an audit. They audited the period of, what is that? They audited a time frame of July 1st through September 30th, 2024. So they contract with an outside, actually it's an outside audit firm, and they make certain selections of payroll data that we have submitted them for our staff. And they have come back and asked for documents, mostly in the form of timekeeping records, payroll. They're trying to make sure that the hours we're recording are in fact accurate. So we've completed the audit and we're waiting for the write-up at this point. So we'll share that with you when we have the results.
This is a nationwide initiative by CMS. They're going to be auditing pretty much every nursing home in the country to ensure that the payroll-based journal entry data that we submit to them is accurate, because it's not only does it measure the minimum staffing standard, but it also measures our 5-star rating for staffing as well.
Yeah.
So.
And interesting, Lawrence, with that, it just refreshed my memory. So the administrative nursing staff, they're not included in one of them, right? The 5-star rating for.
No, it's pretty much all, the PBJ captures pretty much all CNAs, LPNs, and RNs that are hands-on care with residents. That's what the regulation states.
Right. unlike the five-star rating, it does not include hours for nurses with administrative level
Correct,
duties, right?
right.
Yeah, that's the difference. So we're gonna take a look at February results. No IGT funding received, or other revenues coming in at 5.8 million, 53,833. On the personal services side, we've expensed 3.3 million. On the equipment side, we've expensed just under 2,000. On the contractual side, we've already expensed 1 million, and we have an additional 6.2 that we've earmarked that has not yet been spent. The indirect costs will not post until year end. Employee benefits coming in at 2.4 million, and serial bond debt at 13,855. I looked at our personal services and compared this year to last year. Last year, we are up this year 460,948 over last year's performance. And that is because in January and February, the 4% increases for payroll didn't actually hit until July. So that's why there's a difference there. And if you turn to the next page, it should be this week, and you'll see an analysis of our insurance bill types, and we're going to look at the total number of days and the utilization. So our Medicaid population represented 74.97% of the billable days, HMO at 3.06, and the Medicare was at 12.03, and private at 7.95. Our census through year-to-date through February totaled 62.33 on 360 beds. We still have 90 beds offline, and that census comes to 83.11. And the last sheet that we'll be looking at is the historical census.
I know it's only 2 months, so it's not even, it is sensing a trending trend line in terms of this Medicaid going up, Medicare going down.
I think it's gonna stay pretty close to this. Actually, I'm looking at the Medicaid here, it's 78% compared to last year. We were just under 74%. So that's a little higher than normal. But I think it's gonna be right around this. Medicaid is always gonna be anywhere around the 75% range, and we want the Medicare to be in the high teens. 14% is good, like we had in February. That's a good number. So we like it to remain there. Yeah. But there won't be wild swings in the payer. We were pretty consistent all year round with that.
Yeah, you had an increase in February because we started admitting. We started long-term admissions.
We had some more long-term
Right.
admissions, so that's what that is.
And the last one is historical. You can see the history of facility, historical occupancy 2021 to 2025. 62.33 is the average for the 2 months.
I just have a quick update. I think everybody should have gotten a copy of this. We just discussed the census, some details of the census. We are serving 80 male residents and 151 female residents at the time of this update. And our youngest resident residing at the facility is 45 years old, and the oldest is 101. So it's quite a disparity.
Just, I need a motion in a second to go over the update. I
Oh,
didn't
sure,
get there
sorry.
yet.
Oh, I'm sorry. I jumped the gun. My apologies.
So I've got a motion from legislator Sutherland and a second from legislator Ramos. Okay.
My apologies. I'm going too
Continue,
fast
please.
here.
Thank you.
In February, we had 29 admissions, 18 new admits, along with 11 readmissions. A total of 9 residents were discharged home and 1 resident from the facility. In February, the Valley View CHA census totaled 15, and we conducted 182 therapy treatment sessions performed at the home with our CHA services. We do continue to advocate for our budget priorities priorities in conjunction with leading age and other members. We're focusing on issues of great importance to ensure people we serve are supported and represented in the New York State budget of 2025, 26. Early indications are good. If things stay the same, we'll hopefully have that news to you next month as far as the future impacts of the budget. But it's from the information I've received so far, it sounds like we may get some positive movement in the budget for Medicaid reimbursement and some other items. So hopefully that stays. The ongoing staffing shortage remain our biggest challenge. We need to continue to adapt innovative strategies to attract and retain qualified staff, including competitive compensation, flexible schedules, and educational career opportunities for advancement. We are meeting with a BOCES LPN class on site at BOCES this Friday, so we're looking forward to meeting the students that are graduating in June this Friday.
Anybody have any questions?
Thank you. Sorry about that.
That's quite all right. You're helping me keep the pace. I appreciate it. Thank you. Okay, so next up, we have Dr. Jennifer Roman, Medical Examiner, Acting Commissioner of Health, Lisa Lahith, Deputy Commissioner of Health, and Gretchen Burden, Deputy Commissioner of Health. We have Dr. Roman is actually going to be calling in regards to item 3A. And I believe that we should have a letter, everybody should have a letter in their packet regarding this item. So, are you there, Dr. Roman?
I think you have her muted. That's what she said.
Yes, I'm here. I think I just unmuted myself.
There we go. I knew it might be a second or two delay. So this is legislative request number, request to create one additional autopsy assistant, grade 11 position within the Health Department Medical Examiner's Office. The CSEA entry rate for the salary is grade 11. Step 2 is $29.68 per hour, $61,736.90 annually. Legislative request number 59. Can I get a motion? Second. And Ramos. Okay. Do you want to start, Lisa?
I can
and then Dr. Roman can answer any questions.
That sounds good to me. So in 2024, there were 994 deaths in Orange County that were investigated by the medical examiner's office. This resulted in 319 autopsies and 87 external examinations. An external examination involves just a detailed description of the decedent's remains, including scars, tattoos, surgical incisions, and things like that. There are no internal cuts made on the body. No organs are examined, but it does require the assistance of an autopsy assistant, just as a full autopsy would. It's less, but it takes less time, of course, but both of those types of examinations require an autopsy assistant. And of course, there are cases, which I'm sure you all know well, that are in New York State county law that require at least a consultation with the medical examiner. And the decision is made after that consultation as to whether the body will come to the medical examiner's office or not. We do have per diem autopsy assistants on the books. Those staff are limited because of their per diem nature as to how many hours per week that they can work. So if we have a person who is on vacation, coverage is difficult. Also, because they are per diem, they have other jobs, so they may not be immediately available to us. So having 3 autopsy assistants who are in the building full time would enable us to have more flexibility as far as the number of autopsies that we can conduct. Sometimes we might have an external examination due to particular religious requirements that need to be done very quickly. While an autopsy is going on, there are times when we can do two autopsies at the same time in the new building. And then we also have a forensic anthropologist who also uses the space to do those types of examinations. The other thing that the autopsy assistants do is they clean what Dr. Roman calls the back of the house, which is, as you both know, have seen and smelled recently, is the autopsy suite, the Lodox room, and and the body storage area. So they're responsible for an area that's about 4 times as large as the previous space. And because of the new building and sort of adjusting to the new building, the senior autopsy assistant has been helping out with unpacking and putting things away and ordering supplies and managing the receipt of different things, so is not always available. That's a short-term issue, but the additional position is something that Dr. Roman has felt that now, after she's been in the building since December, that would increase the flexibility for her office.
Thank you very much. And Dr. Roman, I want to thank you for joining us via this call. I know you are currently out of state, and I appreciate you calling into us and answer any technical questions anybody here might have. Just before you do, I know that as somebody who went there with Legislative Ramos, we toured it. The amount of space and the amount of work that the autopsy assistant has to do is not just equivalent to a assistant medical technician, but it's the equivalent to a serious medical janitor as well. They do everything from A to Z in the back of the house, which is the back of the house is 90% of the new facility. I know that one of the questions that arose yesterday, Dr. Roman, was in regards to the fact of autopsies are changing. I know we do have the full body scanner there now, as you demonstrated to us, but from what I understand, and I will defer to your expertise on this, is that yes, there are certain things that are changing within autopsies, but they're still going to be the standard autopsy. And if you could address that first, and then we'll move on to any questions any of my colleagues here in the room have.
Okay, I'm happy to answer that. First of all, I do just want to say I regret that I'm unable to be there in person today, so I do appreciate you allowing me to call in to address these questions and concerns. So the full body scanner that you're referring to that we have at our facility now is our Lodox machine, and it's actually a postmortem X-ray, as opposed to what I think might have been referred to in the meeting yesterday, where the field might be headed in the future, is postmortem CT scanning. Postmortem X-ray at this point is the standard of care in the field, and it is used as an adjunct to autopsy, meaning that it by no means replaces autopsy. It helps us see things like locating projectiles in the body to make them easier to find during the course of the autopsy. It can show us fractures that we then have to further document and photograph and detail at autopsy. And even postmortem CT is not currently the standard of care. And while I do acknowledge that postmortem CT is becoming more common in the field, most offices don't have them as of right now. And the research studies that have been conducted all kind of point to the fact that postmortem CT will never replace autopsy. It's used as an adjunct, it's used as a triage, and it's used to direct autopsy. But there are certain things like removing a retained projectile for evidentiary value, or detailing subtle muscular hemorrhages in a case of neck compression. The root of the word autopsy literally means see for yourself, and that will remain the gold standard in the field. Nothing is more valuable than actually being able to see and document those injuries in situ. So while postmortem CT and LODOX helps to triage cases, it by no means obviates the need for autopsy. And even if it does reduce the number of actual full autopsies being done, those bodies are still coming in for external examination. And it's the autopsy assistants who are actually performing on that LODOX machine. So even if it obviates the need for a complete autopsy in some cases, it's still the autopsy assistants that are handling the bodies and those exams.
Thank you very much. I'll open up to Legislator Sutherland.
Thank you, Chairwoman. First, Dr. Roman, I want to thank you for calling in as well, and your dedication to your work. Obviously, we all know you're currently wearing many hats right now. So thank you for everything that you're doing. Lisa, if you could just get the numbers again, the autopsy numbers that you do.
So last year in 2024, there were 994 deaths that were investigated. And they resulted in 319 autopsies and 87 external examinations. Year to date, as of last Friday, we had performed 50 autopsies and 13 external examinations. And then we have other, there are death certifications which are done by the medical examiner, but as far as the autopsy assistants, that's the work that they do.
So obviously then you're doing anywhere from 1 to 3 or more, you know, God forbid, depending on what the situation is today. So obviously there's still more talking, but I'll support this 100%.
Thank you. Okay. Does anybody else have any questions?
Yeah,
Chairman Hines.
I think it came up yesterday with only 2 assistants. There's times, Dr. Roman, where you have a second medical examiner in your facility doing 2 autopsies at once. Is that a fact?
That does happen. That is correct. Because being the only full-time physician, I handle most of the, what you may think of as more complicated or higher profile cases, the homicides, the child deaths. So, but if I have a per diem doctor on that day handling the rest of the cases, I will still step in to handle those more complex ones. So it's not uncommon to have 2 doctors cutting at the same time.
Have you ever had to cancel an autopsy for lack of an assistant?
We have had to delay autopsies for lack of an assistant.
So in other words, a third one could fill in the event that someone was sick, or if you had maybe a larger patient, then you would need 2 at that particular incident?
Correct. We would much more often have 2 at a time, which is the safest and most efficient way to handle these cases.
Thank you.
Legislator Vanilla?
Thank you. Dr. Roman, thank you for making yourself available for today. Quite frankly, it was very unfortunate that you were not available yesterday. And while I think most of us realize that, first of all, when we built a larger building, you were going to have a larger facility, which you were going to be doing. Obviously, we built the building because we saw what was happening with the growth in Orange County. So we anticipated that. But I think it was noted that we have not seen you at legislative meetings, statutory meetings, to be able to answer the tough questions. Your staff, the ladies that are here this afternoon, have done a remarkable job, and they're always there on the ready to be able to assist us in any questions that we may have. But I think it was tabled due to the fact that we really wanted to be able, when it came to medical examiner issues, to have the actual conversation with you that we're having today. So I thank you for that, and we have a better discussion with your presence and your participation. So thank you.
Oh, thank you. I truly regret not being able to be there yesterday. As the legislators know, I always make myself available when I'm called in my capacity as a medical examiner. I truly regret that I was not able to make this meeting in person and yesterday's meeting.
Life happens. We understand.
Thank you.
Does anybody have any further questions for Dr. Roman or for Lisa Richmond? No? So call a vote. All in favor?
Aye.
Any opposed? Okay, the motion carries. Thank you very much, Dr. Roman, for joining us, and I will be speaking to you soon.
Okay, thank you very much.
Thank you. Okay, next up on the agenda is item 3B, request to create one data program coordinator, grade 13 position. The CSEA entry rate of base salary for grade 13, step 2 is $33.64 per hour and $69,990.54 annually. Create one additional senior public health sanitary grade 15 position. The CSEA entry rate of base salary for grade 15, step 2 is $39.05 per hour, or $81,221.71 annually, and create two additional public health technicians, grade 11 positions. The CSEA entry rate of the base salary for grade 11, step 2 is $29.68 per hour, or $61,736.90 annually. All four positions are grant funded entirely through the New York State Lead Rental Registry Grant Program, legislative request number 57. Can I have a motion, please, in a
Motion.
second?
Good.
Okay. Go ahead.
So, all apologies to anyone who heard this spiel yesterday and has to sit through it again, but here I go. Public Health Law 1377, which was passed in 2023 by the New York State Legislature, requires that all property owners of rental units within communities of concern, when the building was built before 1980, and there are two more units that are to be rented, must register their property through a state rental registry and have a lead hazard inspection conducted every 3 years. The purpose of the lead rental registry is to provide at the state level a check in an attempt to reduce the exposure to children to lead. The communities of concern, which were identified by New York State, are the city of Newburgh and the city of Middletown. I know there was some discussion yesterday about Port Jervis. Hopefully, if this program is successful, maybe it could be extended to Port Jervis. It would be nice, but this is what we have in this grant. And again, the communities of concern were identified by the state. Even though the onus is on the landlords to register their property, the local health department, the Orange County Health Department, must monitor that registry, must assist landlords with putting their property into the registry, make sure that their inspections are being conducted in the timely requirements under the legislation. We have to do a lot of education for landlords about the registry and about the importance of reducing lead. We have to initiate enforcement against landlords who do not abide by the terms of the lead rental registry law, or who cannot or will not abate the lead in their property. We also have to conduct an inspection of 10% per year of the total number of units that have to be inspected per year. So these four positions are designed to do that work. They're entirely funded under the lead rental registry. The first one, the data coordinator position, is a new position for us, but is highly recommended by the state for the grant, because this the program, which is the state rental registry, the software program, we haven't seen it yet. And as you all know, I've been here before about the EI hub, and we feel like we need a specialist in this data communication and coordination in order to both assist the landlords and also to administer, maybe figure out how these programs are going to work. The other positions are positions that we already have in the health department. It's a new senior sanitarian who will be supervising this whole staff, and two new techs. Those three people will actually be doing the inspections.
Okay. Just to note, yesterday in personnel and compensation, the language in this, legislative request, excuse me, did not have that, Betsy, how exactly was it worded with the termination upon termination of the
There was
grant?
a motion made to abolish the positions upon the termination of the grant funding.
So, do we need to also do that here?
It's up to the committee, if
Okay.
that's the choice.
So,
Yeah, but that was some of my thought, I guess, how long is this grant? Yearly?
It's 5 years.
5 years.
5 years.
And so it's up to the law. the law
Yes.
requirement. So if the grant stops, we're gonna be responsible to do it. If we need to make that motion, I certainly would to do it, to make a motion if the grant stops, the positions be abolished.
so I have a motion for.
Second.
Second,
Discussion.
over discussion.
Yeah, so after 5 years, if we lose the grant, you're saying that we're not gonna go out and inspect these houses because can't fund it internally? Yeah, we have to keep those positions if it's mandated for lead inspection, and you're talking about doing 10% per year, I think you said. So after 5 years, we're only gonna do half of them at the most, because 50% of these places with lead won't even be inspected. We're gonna abolish the positions, I disagree with you 100%.
These, is the grant gonna, I guess you can't look ahead, but 5 years, but, is this something that they would normally extend and bring in?
Most of our lead programs, like Clip
Continuous.
Plus and others, have been funded for a very long time. So this seems to be a priority, but as we know, today, it's really hard to predict what's going to happen in the future. What will be required, which is required under the law, is that the rental registry continue. That landlords will still be required to enter their property either upon sale or acquisition of a property that meets those requirements. They will have to register into the registry. Right now, it's the health departments that are being required to manage those. Hopefully, it would not continue without grant funding.
Just to follow up, yeah, I think that it's a good question. I think that we know the state's budget and what they go through with Medicaid, especially the health department and being caught, it's a very serious kind of cost. It's not unusual to say, where can they save money? That just maybe, it doesn't preclude us from hiring, but what it does, it would ask us to act. Now, it's the end of 5 years and the grant ended, and we'd say, well, we're gonna abolish it, we could, in the next resolution, re-up it. But at least it doesn't stay on for years and years when we don't even know if it's really affecting what we think it is. So I think the message to the department is keep the data well, keep good data from now until then, so we see exactly the impact. And then when it comes to that, if it's really something very valuable, as you were suggesting, then I think we just re-up it. But at least we're at a sort of a sunset position. We have to make a decision. I think that's important, because it can go on forever. I mean, I'd vote to continue it if we knew it was a good program and it was working and it was helping.
So we'll have time to evaluate.
That's what I think we should. It's not just here forever. It sunsets and we can just re-up it if we want. That's all.
I agree with that.
That's all.
Yeah, I just, the numbers aren't registered real good right now. We're gonna do 10% inspections, so we're gonna take 10 years to do the whole. But they have to be re-inspected every 3 years.
Right, so they have to be,
It doesn't work.
so we're not doing the inspections, we're auditing 10% of the inspections that are done each year.
Who's doing the inspection?
The landlords are doing the inspections.
So the landlords are inspecting, so they have inspection kits, or they have to go.
Right, we have money for
Take a
risk
paint
assessment
scraping, or
training.
they scrape the paint, they put it in, get a litmus test on that, to see if there's
Right,
lead in the
right,
paint, and they have to do this every 3 years on that same wall that has been painted, and then we audit their results.
Correct.
We don't do the physical.
not as part of this program.
Do they, then they do the testing every 3 years and then they have to report it back? Now, if you don't get it, or if you have a landlord that doesn't report back, does does the health department go after them?
That's the enforcement piece.
Okay.
So,
Some checks
so we
on
do
it.
that now, under a different program. So we hold hearings, we have a hearing officer, we have an attorney that represents the county.
Do you have a rough number of the people that don't comply?
I would say
What percentage?
that the majority of the responsible landlords comply. There are a few that we have had over the years who, let's say, speculated in investment properties and it didn't actually pan out for them. And they end up in bankruptcy court or they end up losing the property in some way. It doesn't necessarily affect the issue of lead in the house, because if there's lead in the house, it has to be posted so that any subsequent buyer or tenant would know that there is lead there, and they're not supposed to transfer ownership without that new owner acknowledging that. And then the responsibility for either remediation or it passes on to the new property owner.
So the ones that are, not as diligent or in this group, what, I mean, out of the whole group, what percent would you say that
I would say
they're
it's,
not good?
I would say maybe it's like 10%. Most people are pretty, like, if we're going to a hearing.
Yeah.
We have tried to work with them, we have tried to help them find contractors to help them do the work. And people who are in the community, who live in the community, they're very good. It's your landlords who live in other places who are harder to track down.
Makes sense. Thank you, Chairwoman.
Thank you. Any other questions? So on the amendment, all in favor?
Can you just state what the actual amendment is again?
That's it.
Sure, it is a motion to abolish the positions upon determination of the grant.
Abolish it and then reevaluate. I guess.
If you want to add that language in there. I think at this juncture, it would just make sense to leave the motion to abolish as it is.
the end of sunset.
And certainly, I'm sure the department would advise if there's notification that the grant should
Thank you
be
for the
ended,
clarification.
of course.
So on the amendment, all in favor?
Aye.
Any opposed? And then on the actual request to create these positions, all in favor?
Aye.
Any opposed? Okay, motion carries. Next up is item 3C, request to accept and appropriate second-year funds into the operating budget for the lead rental registry program for the New York State Department of Health for the period of 4/1/25 through 3/31/26 in the amount of $728,600. Legislative request
So moved.
number 64. We have a motion from Legislator Tui. Second was, I'm so sorry.
Second.
Thank you. All in favor?
Aye.
Okay,
Please
that was.
discuss, I'm sorry.
Let's just move right along.
Zip it out.
Make them all go like that.
Okay.
So this is the grant that's paying for the positions that you just approved.
Let that feel.
You deserve to get this out.
Okay, any questions for anybody? Okay, now all in favor?
Aye.
Any opposed? Okay. Next, item 3D, request supplemental appropriations for 4-year funds from New York State Department of Health for the Healthy Neighbors Program grant for the period of 4/1/25 through 3/31/26 in the amount of $275,000. Legislative request
So
number
moved.
61. Second.
Okay, so the Healthy Neighborhood Program provides preventative environmental health services addressing childhood lead poisoning prevention, asthma, indoor air pollution, fire prevention to targeted communities, mostly comprised of low-income families and in the area of Middletown and Port Louis.
Any questions? Hearing none, all in favor?
Aye.
Okay, item 3E, request to accept and appropriate second-year funds into the operating budget for the Adolescent Tobacco Use Prevention Act grant from the New York State Department of Health for the period of 4/1/25 through 3/31/26 in the amount of $116,050, legislative request number 63. Have a motion. Thank you.
So the ATUPA program is the Adolescent Tobacco Use Prevention program that we run through community health outreach. It's in addition to tobacco use through cigarettes and cigars and other types of things. It also involves the inspection for people who are selling flavored vapes in Orange County. So this funds the position and some of the money used to attempt to purchase these products, either for our youth compliance workers or our adult compliance workers.
Thank you. Anybody have any questions? Okay, hearing none, all in favor?
Aye.
Any opposed? Okay, item 3F, request to accept and appropriate 3-year funds into the operating budget for the New York State Department of Health Immunization Action Program for the period of 4/1/25 through 3/31/26 in the amount of $202,263, legislative request number 62. Can I get a motion and a second?
Second.
So this grant is with our Patient Services Division. This provides assessment, outreach, and vaccination to improve childhood vaccination for vaccine preventable diseases.
Anybody have any questions?
No.
Let's start.
It's a 3-year program, but this is only for a 1-year period, so this is gonna be times 3, or is this gonna be for the 3-year?
It's a 5-year program. We're only appropriating the funds for, this is year 3 of the 5-year fund.
It's not a 3-year program, it's the 3rd year of a 5-year
Right.
program.
Mhm.
It says.
For year
It's gonna
3
accept
funds.
the appropriate
For year 3, this is year.
My bad, thank you.
Any other questions? Okay, hearing none, all in favor?
Aye.
Next up, we have our monthly update from the health department.
Okay, I provided a lot of information. I'm just gonna highlight a few things. It's hard to believe, but it's been 5 years since the beginning of the COVID pandemic, which has changed all of our lives. And I'd like to thank all of the efforts of the health department workers who have seen us through this pandemic. They did a lot of great work and deserve the recognition. We also have, through our intervention services program, we have the Family Center at the Armory in Newburgh, which if you haven't stopped by there, it's great fun. It's I think Legislature 2, you've been by there.
I was there, yeah.
Yeah, it's a lot of fun. It's children and their families in just from all over the county now who are coming and for learning and playtime and interaction with other children and families to interact with other families. It's a lot of fun. We have some video. We have a new video up on the Orange County Department of Health Facebook page that you could check out. And then the last thing I just want to talk about is right now, even though it's a little colder today, we're sort of thinking about spring, that it might be coming. And this is the time of year that we get children's camps registration and pool openings and things like that. So we're very busy in environmental health. If one of your constituents should contact you with questions, or do I need to, please just give them my phone number, give them the health department's phone number, and we can help them navigate through whatever it is they need to get, whatever they need to get open.
Anybody have any questions? No. Thank you very much. Have a great evening. Next up, we have our very own chairman of the legislature, Kevin Hines.
Hello, two of you are going to be happy about this, I see.
So this is a resolution appointing me, Lori Argyle, the Board of Health of Orange County Health District. Term expires 3/31/25. Pete, are you that anxious to get off?
He's gonna get the full experience.
Yeah.
Okay.
So Peter has decided to step down and Lori has agreed to step up to be on the Orange County Board of Health, and I would like you all to please make that happen.
Any discussion, any questions?
All sponsored?
All sponsored.
Well spoken. Thank you. Dory, did you catch that?
I have that, yes.
Okay. All in favor?
Aye.
Any opposed?
Thank you.
Thank you, Mr. Chairman. Okay, so I'm going to entertain a motion to, Dory, I have to close this one, then we reopen, correct?
That's
Okay,
correct.
thank you. Thought so. So I'm going to entertain a motion to close the health and mental health meeting, and then we will make a motion to immediately resume it. I don't believe I have, do I have to stop the recording?
No, you don't.
Please don't touch any.
Yes, do you think so? Don't want to. I know you got a Zoom standing by.
Don't do
Okay, so a motion and a second to adjourn?
So moved.
Second?
Second.
Okay. All in favor? Okay. So now, can I have, you want to,
I will do a roll call for both committees.
yeah,
For you.
well,
I'm serious stuff.
Legislator Amo will roll call for the second
No,
committee, or you want me to do it?
I'll do the roll call with
Yeah,
everything.
okay.
Okay.
So are you ready,
For the
Legislator
committee, I
Amo?
don't know if anybody wants to come to the table, they're more than welcome to, or they can stay. For the,
Yeah.
for the committee members.
Are you ready, Legislator Amo?
Yes, I am. Let's go.
Thank you. All right, so good afternoon. We're still recording. We're still live and in person. We are not Saturday night, but we are opening up the Joint Health and Mental Health Committee and Valley View Advisory Committee meetings. Doreen, can you please take roll call for health and mental health?
Absolutely. Amo.
Here.
Benelli. Present. Ellers.
Here.
Feller.
Here.
Ramos.
Here.
Sutherland. Here. Tui. Tortel.
Here.
Okay.
And then could you also please take roll for the Valley View Advisory Committee?
Absolutely. Padu. Tortel.
Here.
Flanagan.
Here.
Ledoux.
Here.
Wiley.
Here.
Lucas. And Amo.
Okay, so first up on the agenda, we have Legislator Michael Amo, Chairman of the Valley View Advisory Committee, for an update on Valley View Campus Master Plan. We also have via Zoom, Brian Ellsworth, the Health Dimensions Group. He's going to be doing a presentation to us to bring this committee up to date as to where we are with the Valley View Advisory Committee. So I'll turn it over to you, Chairman.
Real quick, so we, time sensitive, late in the day, and let Brian do most of the work. We've been working on this proposal for a few years now, and the RFP went out. Even the Valley View Advisory Committee incrementally hearing what's happening. It occurred to us with the new chairman and other members of the committee, and let's bring it over and have some kind of a briefing, where we are as a Valley View. And so, I'll introduce to you Brian Ellsworth, who's from Health Dimension Group. Brian, you can take it from here.
Thank you. Can you all hear me?
Yep.
Yes.
All right, let me call up my screen. And can you see the presentation on the screen?
We can.
All right, terrific. Well, greetings from Washington, D.C. I'm sorry I couldn't be there with you in person, but I find myself down here in Washington where the weather is very nice, but the cherry blossoms haven't quite come out yet. But it's thank you very much for inviting us to present about this project. It's been a wonderful project, and we've been moving along in our activities on it. And owing to the lateness of the hour, I will be very brief, and then we'll leave some time for any questions or comments you may have. So I just want to give you a brief overview of the project and bring you up to speed as to where we are, and then talk a little bit about next steps. So this project was created as a result of an RFP to develop a master plan with the eventual goal of creating a project that could be executed by a developer and sustainably operated by an outside operator. The master plan was to look at the developable land on the Valley View campus, as well as repurposing space at Valley View, particularly the Perry building. The project must meet the needs of the community and help to sustain the long-run viability of Valley View. And the RFP had noted that they were looking for a range of options, including housing and new programs and creative ideas. And this project is proceeding in 5 phases: project mobilization, market assessment, conceptual master planning, financial analysis, and then a final report. We are in the middle of phase 3, the conceptual master planning portion of the project. This slide gives you a timeline of the phases of the project. And we are constantly kind of looking at this and adjusting things. But right now, we're in phase 3, as I indicated. Next step after this will be financial analysis and then the final report. That's on track at this point to be done by June, which is the timeline for the current contract. So in terms of the project update, we've completed the market analysis, and that has what we looked at was the market need for 5 different service lines, 3 market rate service lines: independent living, assisted living, and memory care assisted living, and then affordable senior housing and and skilled nursing. So we looked at those 5 service lines. We defined a primary market area, which is basically the center of Orange County. And the reason we need to do that is the way our need methodologies work is we need to have a fairly tightly defined primary market. And that then helps propel the mathematics for the rest of the methodology. That said, the secondary market is obviously the rest of Orange County, and we understand that this project is designed to serve the needs of the whole county. However, particularly when you're entertaining building bricks and mortar things, you have to have a fairly tightly defined inner market that is what is considered the primary market area. We also looked at the future demographics as well as the current utilization. We looked at the competitors in the market and went into the market rate buildings in the primary market area. And long story short, we found for the 3 levels of market rate senior living, we found clear evidence of need for independent living, assisted living, and memory care. A big factor in that need is that the age 75 cohort is going to grow by 20%, close to 20%, 19 and change over the next 5 years in the primary market area. And so that is a little bit higher than what we see nationally, but as everybody knows, the elderly demographics are really growing across the nation, across New York State, and certainly in Orange County as well. For affordable independent living, we reviewed that service line as well. And similar to what we find in almost every market that we look at, there is clear need for that. There are almost everybody in the primary market area is 100%. Yes? Yes?
Are you there?
Was that a question?
No.
Oh,
That was-
okay. And so there's a lot of wait lists and for affordable housing. And the upside of this is there's definitely a lot of demand. Affordable senior living units can be a little bit more challenging to develop and operate profitably. And there's usually some forms of subsidies that are required. There is an example of this on the Valley View campus itself in the form of Hearthstone, which is in the old county facility. That is a affordable senior living. So there already is this service line present on campus as well. And then finally, we looked at the skilled nursing market, and it's been an interesting phenomenon there. As with many markets after COVID, and we were just talking about the 5-year anniversary, the use of nursing homes shrunk precipitously in 2020 in almost every market across the country. And then in some markets, it has rebounded. Clearly, what we are seeing is that any of the retrenchment in the nursing home world has bottomed out. And in fact, occupancy is starting to tick back up. Although what we did witness when you factor in the population growth over the last 5 years is that the actual use rate of nursing homes is actually appears to have permanently shifted in Orange County by about 20%. It has been reduced. And so that is a significant kind of sector-wide phenomenon. Valley View appears to have borne about half of the countywide census drop, and currently has an occupancy in the 60s with 3 units closed, and as they mentioned just previously, 90 beds. And so part of the reasons for this downshift in nursing home use are increased competition from Medicaid-funded assisted living over the last 5 years. It's very apparent that the amount of Medicaid in assisted living has gone up significantly in Orange County, and also from the self-directed personal care program where Medicaid funds personal care assistance through a self-directed model. That program has also grown. Both of these two programs substitute in part for nursing homes. All of that said, it does appear that there is going to be future need for nursing home care in addition to the other service lines that I talked about. 5 of the 10 nursing homes in Orange County are over 90% occupied. One of the remaining 5 is a retirement community and is not really comparable. And so considering the population growth of 20% of the age 75 cohort, this raises the prospect that you may also confront some access issues for Orange County residents needing nursing home care in coming years. So that kind of summarizes the market analysis. Next thing we looked at was a site review in the physical plant. Clearly we saw in terms of looking at the current physical plant that Valley View has really an aging physical plant and an inefficient layout, which drives unnecessary operating costs. And we'll talk about a facility condition assessment in just a moment. So a couple of other operational challenges that Valley View is experiencing, and were just discussed, was recruiting nurses. That can be a limiting factor in taking admissions and in taking higher acuity residents. And also Valley View has a limited number of contracts with managed care companies, so-called Medicare Advantage. And that can limit who you can accept for admission if you don't carry a contract with that particular plan. My understanding is Valley View has got items in the works for both the nurses and the managed care contracting issues. So we just thought we would note those for completeness sake. The facility condition assessment was a significant study that was completed in February of 2024. And it very much backed up what our on-site assessment was, which was that there's a wide range of needs for kind of repairs and renovations to bring Valley View itself up to current operating conditions, is what the report framed it as. And they identified a total of 600 projects into 3 buckets: high priority, about 20%, important about 40%, and deferrable about 40%. And those 3 buckets totaled up to about $50 million in expenditures, which is fairly significant. And these covered areas like the exterior shell, the interior shell, the HVAC, electrical, plumbing, grounds, statutory driven requirements, and handicapped accessibility. So
Lori? Yes, a question I want to ask Brian.
Yeah.
Michael Amo, these projects, just to emphasize that, they basically bring the facility up to what level?
The report used the terminology current operating conditions. So basically, you just need to do these things to kind of bring things back up to basic use. So that would be as opposed to entertaining new programming or developing state-of-the-art design features, that kind of thing.
It also affects the marketability of the facility in competition with other nursing homes in the county.
Undoubtedly. And as we'll see in the stakeholder discussion in just a moment, that was an area identified by stakeholders as well, a perception. There's also some site issues with Valley View, both with respect to sewage and water. The sewage plant, there's a new wastewater plant in development that's going to free up the current site of the sewage plant, and that will also provide services to other county entities. And we've made a connection with the folks from Delaware Engineering, and we understand that any new development that we might be proposing in this study would have to factor in capacity issues in terms of sewage, as well as water. And so we have those 2 issues on our radar screen as well. So turning to conceptual master planning, one of the first things that we did when we hit this phase is we conducted a variety of stakeholder meetings, primarily in December and January. It was a very robust set of discussions with the groups that you see here on the slide. And we got a lot of really good feedback and a lot of engagement. People were very interested in this issue and had opinions on them. And we were able to take that and synthesize that into the next slides that you see here. So among the common threads, and this is relatively in priority order, Valley View is clearly valued by the community and has a good reputation. It's well regarded. That we heard that throughout all of our discussions with the stakeholders. But there was a lot of noting that the physical plan is outdated and in need of significant capital investment. In terms of an aspirational discussion that we had with the stakeholders, we had a series of questions, some of which were designed to pull out kind of what are your hopes and dreams. And consumers were pretty consistent in terms of desiring a continuum of care that promotes aging in place. And so what that means is having multiple service lines in one campus and multiple services, kind of a one-stop shopping thing, so that you can age in place in the continuum without having to kind of move, at least move, beyond the campus, and with kind of a desire to have ancillary services nearby as well. And so one of the things we noted in our market study was there really wasn't a lot of kind of multi-service line providers in Orange County, again, with the exception of Glen Arden, which is a continuing care retirement community, which is actually a model that's explicitly designed for kind of a continuum of care. Besides them, most of the other providers in the community were kind of single service type of providers. Third major point we heard repeatedly was that Orange County needs affordable senior solutions for the middle class. Yet we also, in these discussions, and it's very natural, we also hear a desire for amenities and the one-stop shopping that I talked about, but also some thinking that some of those kinds of services could be possibly funded as a commercial venture in terms of maybe having, a grocery store nearby and those kinds of things. But the need for affordable options was definitely highlighted. Another issue that came up quite frequently was transportation. And for instance, my understanding is Valley View is not currently on a bus line. And so that's an example of something that could be corrected. And primarily that would help staff more than anything. But having a transportation strategy to bring people into the campus to use some of the campus assets, along with handicapped accessibility, we heard from several stakeholders, and improved cellular coverage, which we heard from the staff in particular. Another desire was that the campus should become a resource for all Orange County residents with respect to aging and wellness issues. So we heard a common theme about bringing in kind of the wellness piece and a community resource, a community center, and things like walking trails, and really kind of leveraging the campus along those lines. And then finally, there was a fair amount of discussion about partnerships and collaborations with nonprofits, education, government, and the private sector. And we heard some things like, for instance, consolidating the Office for Aging functions onto the site, including their kitchen, and as well as having an office there, and possibly that being a resource for Orange County citizens, and also working with the educational institutions, and having Valley View be more of a resource directly in training staff and that kind of thing. So with that feedback in mind, we kind of work through a set of what we call design principles that, and by we, I mean Health Dimensions Group and our partners in this effort, Community Living Solutions. And these included constructing a multi-generational campus with diverse living options to serve individuals of varied economic means. So there's a lot going on there, but the idea is to have a wide reach. Secondly, develop a master plan that creates opportunities for private sector development. Third, leverage the campus assets, the land, the topography, the existing structures where financially viable. Fourth, create a community center for education, access to resources, and activities for older adults. Fifth, develop a financially sustainable plan that lessens Orange County's financial contributions to the campus. And then finally, develop an area to enhance physical and mental wellness, so the wellness piece. So those are the design principles that we are using as kind of our North Star as we plunge into the design process, which is literally the step that we're at right now. And what we're doing is developing options and designs to address the developable part of the campus. And what we're going to do in that process is we're going to look at the aspirations, and then we're going to balance that by looking at what's financially viable, what would be attractive to an outside developer, and what has a revenue stream to it, and balance those out so that you get the most amount of desired thing that is financially feasible. And then secondly, we'll have a variety of practical considerations that kind of enter into the picture here, looking exactly at the topography, looking at how, if anything was developed, how would that impact Valley View's operations, looking at construction logistics, how do you do this, and you know, kind of in stages, and how would that work? So the other big thing is that we're going to need to, we're keeping kind of in the front of our mind, is that ensuring that the additional campus living options can be phased efficiently and operate cohesively with each other and with the existing Valley View facility once development is completed. And here we're kind of confronting a little bit of a conundrum in that keeping Valley View itself completely separate from the rest of this thinking about developing the rest of the campus, we believe is somewhat suboptimal, and it has the practical effect of limiting some of the considerations that we would do, and it's suboptimal in the sense that it could lead ultimately to an outcome where the rest of the campus is developed around Valley View, and that's a shiny new penny, and then you have all of these significant repair and renovation in Valley View unaddressed. So that's the conundrum that we are dealing with right at the moment. Our next meeting is on the 27th of March, where we will be discussing the design options for the developing the developable parts of the campus. So that is my presentation, and this is how to contact me, and open for any questions or comments or discussion.
Okay.
Yeah, I think you're still there, Brian, you might be able to help us with it. When we put the RFP together, to be clear, it excluded doing anything with the Valley View building itself. We said, let's talk about the area around it. The Valley View is our nursing home, the county owns it. And the county runs it. What can we do to make this wellness campus, this place where people feel they can integrate with a lot of services? As he was doing that, and you talked about it today, we realized that the efficiencies of Valley View physically, and over some programmatically, are not really compatible with the new campus we're going to build. And so the question we had in our mind, but it's not part of this contract, is that should we as a county be entertaining building a brand new Valley View rather than put $50 million on state money, what we have, build it that really meets the current needs of the people of Orange County, enhances, our burden reimbursement, provides services. It's not part of his job. that sort of came right cold in our face. Maybe Brian, you can address this question. You said that in one of the things that a lot of people thought Valley View was a really good place. And that's the same feeling we hear a lot. But how do you, from a marketing perspective, how do you think, how do you explain the fact that CMS doesn't have the same agreement with us? That on the 5-star program, which is the way you rate a nursing home, a skilled facility, 1 being the lowest, 5 being the highest. Due to a lot of issues that we talked about here, inevitably, Valley View becomes a 1-star program. From a marketing perspective, is that sustainable in terms of nursing care going forward 10 years? Does that mean?
Yeah, I mean, that's a great question, and there's a lot of elements to the answer of it. So I'll try to kind of keep this brief. The star rating system has a bunch of different domains to it. Staffing is one of them. That is by those reports, the payroll-based journal reports that they was referenced before. Quality measures, and then health inspections. Now, the health inspections can be influenced by the condition of the facility when they cite you for certain kinds of maintenance issues and things that have potentially life safety implications. That can then pull that part of the rating down. And so there is a direct relationship through that metric, but the long story short is the 5-star system also looks at other things, including quality of care and staffing levels. And I think the more general question about marketability is a fair one, particularly as time goes by and those buildings aren't getting any younger. To the extent that competitors or consumers, develop other things and other options, then people will go that route. Or there will be just increased clamor to, fix the building and make all these necessary changes. And the other part of this that I think besides marketability, that's really actually key to understand is that the inefficient layout really also drives operating costs and makes Valley View more costly than it would otherwise be, just to merely operate it at this inefficient scale with all this old stuff that needs to be fixed. And finally, it can also be a new facility can be an attractive option for staff, which is not an inconsiderable consideration.
Just to piggyback on the 5-star, we have one of the reasons why we have 1 star is because the rating system is heavily weighted on our annual inspections, and it counts the last 3 inspections that we had, and we hadn't done terribly well on those inspections. We can't change that score until we get another health inspection, and we don't determine that. CMS determines that. We're coming up almost on 2 years now for our next inspection. So, and it's been quite we've been in that situation before. We've waited almost 2 years for an inspection. So the star rating isn't going to change, unfortunately, until we get inspected again. Hopefully we have a better inspection, and then one of those older inspections drops off, and then we have, 1 better inspection and 2 others. So that's just a piece of that. Another piece that I don't think that's not mentioned in your report, Brian, that I just thought about recently is I'm not convinced the county has the manpower to facilitate all the bids and all the projects and all the contracts that need to be done with all this $50 million in fixes that need to be done. And that just further speaks to the point of potentially building, it doesn't have to be a new 360 bed building, but maybe it's 100 hundred and whatever bed building, attached to the newer building, Glenmere. And this way, instead of spending $50 million on repairs, you can get all that done in one shot. And that'll take a lot of less county resources in the future. I mean, we have to have finance and budget and the law department and Department of General Services, all of them have to be involved anytime anything has to go out to bid. And it takes a long time for us to get long projects out to bid. And this isn't faulting any county department. It's just the fact of, you know, to get big projects done takes a while. And there's a pecking order in the county, and, you know, Valley View's not always gonna be at the top. There's other priorities that the county executive has, or the Orange County has to do first before the Valley View project. So, you know, that's just another piece that I don't think we've really considered or talked about going forward, and that one kind of struck me the other day. So I just wanted to bring that.
You know, one good, Brian, that want to tell you that, but when you mentioned we only had one Medicare Advantage contract. I think that was only on
Yeah.
You might be able to help us on that, but I mean, I think there's some in the 20s are out there. We see it on TV all the time. You want to go to take your Medicare Advantage, come to us, and we'll give you eyeglasses, we'll give you all kinds of stuff, right? Well, they're in the driver's seat, and they're going to look, I think, and you tell me if I got it wrong, they're going to aggressively look at nursing homes they want to work with. And if they can't make a deal, then they'll go somewhere else.
I mean,
how that works.
I think Brian could probably speak to more about this, but I mean, I think it's all dependent upon the market penetration. Orange County's market penetration in Medicare Advantage is growing, but it's nowhere near what it is up in Buffalo or in upstate New York, where it's almost, you know, 100% Medicare Advantage. And you have to be careful. You have to balance. You have to walk that tight wire when you're in a nursing home, because do you want to average over $700 a day in reimbursement for Medicare, or do you want to take in a Medicare Advantage patient and get maybe $400 a day? So, you know, there's that balance you have to weigh as well. But it, you know, it probably is driven by the market that you're in as well. Right now, we're not, you know, we're not gonna die by not participating in the Medicare Advantage plan. But to his point, I think, you know, in an earlier presentation, the Medicare Advantage plans are starting to penetrate the market, and we will have to get into that game in the future.
Yeah, I would agree with all that. Yeah.
Thank you.
No, I think it's, we're struggling with it. We know we're gonna get from this group, we're gonna get the Valley View Advisory Campus, and we know it. But in the back of our head, we keep thinking, you know, is that all? You know, do we need to do more to make this really work? And I know part of the report, and it's gonna come out, that one of the factors for your Medicaid rate is capital. And so if you actually fix things, you may not get the benefit that if you built brand new. You may raise your Medicaid rate through the capital improvement rate. Now, we don't know what percentage that this could be, but we'll find out. It may be just, why not do it? Because we'll get more Medicaid money. Go ahead, Bruce.
We have done some preliminary work with our accountants. The state will reimburse the facility a certain dollar amount per bed if you build new beds. Of course, that's going to be a whole huge process. You have to do a certificate of need and everything. But the state will reimburse us. Do you remember how much it was? Do you know how much it is, Brian, approximately? I want to say
it was 320,000 a bed, I think it was.
$320,000 a bed if we decide to build new beds. So, you know, that's a factor.
And they will also reimburse for renovation and repair as well. So, and it's all kind of, there's a lot of complicated policies in there.
Right, and I think if you do everything in one shot, we'll get it back in one shot in our Medicare rate, as opposed to doing it piecemeal. So the other piece, I think, you know, Legislator Amo, Chairman Amo mentioned the scope of the work that needs to be done to, you know, that was kind of outside of the scope, and I think we really need to, as a county, take on that next thing and look at, you know, include the Valley View piece in there, because if right now it's not taking into account us building a new building. If we wanted to build a new building, attach it to the Glenmere building, I'm just, you know, talking hypotheticals here, then you have older buildings that could be accessed that may not be included in their planning right now because that wasn't the scope of the work. So I think I think we need to take the next step and do the additional work and have them do the additional work or whoever. But that's just my.
One of the questions that I know the Chairman Hines and I talked about is that one of the proposals that this particular consultant on their, the current RFP, and it ends in June. We asked them the question about what would it cost us, or what would a new Valley View look like? And their response came back after calculating numbers. They can modify their contract for $30,000 and actually come back with the exact a description of what a new Valley View would be like and what it would cost, so it fit into what we're doing with the whole thing. That's not part of the current situation.
Right.
We're gonna have to decide if we as a legislature and the county exec wants to go that next step, just to get a picture of what it might be. We may have a plan, we may never do it, but at least we have a plan. And the gut feeling some of us have is that the $30,000 is a really good deal because it's sort of part of a contract. They've already got a lot of data and information already. If we didn't do it now, we decided a year from now we want to do it, and we went out with a new RFP, pretty sure it'd be a whole lot more than $30,000 to do that.
How long would it take?
Ask him.
Brian, thank you. How long would that take if you were to, extend and, with the $30,000 to give us that information?
I think we could fold it into this scope of work and, assuming an expeditious approval, we would just fold that work in concurrently with the rest of the stuff we're working on. And kind of keep to the timeline. I would say, just as a safety matter, maybe extend the contract from June to, say, the end of August. But I'm hoping that we could actually pull that part in and get close to June as possible.
Okay, thank you.
And we all know this story, as we heard, as Lawrence said, the level of approvals we have to through to get that done. It slows us down, we have to add that, and it takes us 2 months or 6 weeks to get all the approvals. Now we're forcing it to go to August. If we could get, we just cut a check today, we probably get it done by June, but that's not part of this contract. I'm just saying, okay, this is a possibility.
Michael?
But
So this would be obviously something what we would have to do to amend the RFP. It would have to come before Health and Mental Health, have to go before the County Executive's Office too, if I'm not mistaken, Chairman. Am I right in that?
Yeah, because they signed the contract.
Right. So you would have to get a proposal together and start that process in order for us to get it right here.
yeah, Brian, do you have a proposal already? I know you talked to me about something. Do you have a proposal?
We could get you something more formal than.
Okay, yeah, do that, then we can pass it around and look at it, so we know what we're talking about.
Yeah. If you could do that, and if you could, I believe you have Doreen's email, if you could send it to Doreen so she could.
They have a great relationship.
Yep.
They know.
She could share it throughout both committees.
He's terrific.
And then work on the process of, hashing that out ahead of time.
That's good. So I think you got the picture where we got, I think, we're gonna get a really nice campus, even if we don't put a new building there. It's gonna be really interesting. I mean, I know the Office of the Aging could make it exciting where they talked about having a restaurant there that they could actually, people could go there. We talked about having a welcome center, which we didn't tell you here, where somebody would come in and say, gee, I'm 50 years old and I want to retire in 15 years and I want to go work and where can I go? What's available for me? And you could actually, through the internet searches and lectures and stuff, we can learn, we can have lots of interesting stuff for wellness. And I think we can bring in a lot of our own departments to help people. So we see the senior as the resident as a complete person. Need all the things, whether it's your Social Security, your Medicaid, and others, it can all be within reach of the county. It can be a really exciting campus that I don't think exists anywhere. It'd be really exciting if we had a brand new Valley View, but it'd still be exciting this way. So Brian, thank you. I know everybody wants to go.
Thank you very much. Does anybody, any other comments or questions? Okay, hearing none. Thank you very much, Brian.
Thank you so much.
Thanks, Brian. Thank you very much. I'll entertain a motion to adjourn the Health and Mental Health Committee meeting.
I motion to adjourn the.
Sutherland and Henry.
How are you?
So moved.
You all right over there? Yeah, I'm working.
Valerie Beal. Do we have a second for Valerie?
Oh, jeez.